Hello. First of all, I want to thank Organizing Committee of Business Law Management and International Conference on Advanced Marketing for providing this situation for us to present our article. This research article entitled The Effect of Acupressure on Intestinal Function in Patients with Acute Myocardial Infarction under Primary Percutaneous Coronary Intervention had been done by interdisciplinary researchers Professor MASOUMEH BAGHERI-NESAMI, Professor Ali GHAEMIAN, Dr. MAHMOOD MOOSAZADEH, Dr. NADALI ESMAEILI, Ms. FAHIMEH GASTROINTESTINAL, Mrs. SAHAR HAGHIGHAT, and I, MAHSA KAMALI, as a presenter of this research article. Acute myocardial infarction patients experience constipation following admission to intensive care unit due to inactivity, use of medications such as calcium channel blockers, narcotic, and diuretic. So the main purpose of the present study was to determine the effect of acupressure on intestinal function in patients with acute myocardial infarction under primary percutaneous coronary intervention. The present randomized clinical trial was conducted in heart center affiliated to Mazandaran University of Medical Sciences, Iran. 90 patients who had inclusion criteria were randomly allocated to 3 groups. Data collection tools were socio-demographic questionnaire, Rumford scale, and Bristol-Stool scale. An intervention was carried out 2 times a day for 3 sequences a day. In the intervention group, intervention was carried on acupressure points including ST25, SJ6, SP6, and LI4 in both parts of the body symmetrically, so that 1 minute vertical pressure, then 5-second rest, and after that 1 minute rotational pressure. In the placebo group, intervention was conducted on 1.5 cm distance from acupressure points. All of the 3 groups received routine treatment, including magnesium hydroxide. The results showed no significant difference in terms of age and other demographic variables. None of the patients had defecation 1 and 2 days after intervention, but significant difference in terms of frequency of defecation had been seen 3 days after interventions. Stool consistency were significant different 3 and 4 days after interventions, so that 93.3% and 96.7% of intervention groups had normal defecation respectively. The results of present study showed the frequency of normal defecation in the intervention groups was higher than placebo and control group. So, an acupressure as non-invasive and safe procedure can be used in clinical setting as nursing intervention.